My name is William Hickman, and I did my presentation or my experimental research on prenatal exposure to pollutants and the development of asthma in children. So the intro, our communities are all full of different toxic pollutants. They come from anything from factories, traffic, anything like that, and these pollutants fill our air that we breathe every day. Expecting mothers are told to be careful of certain things that may affect the fetus. These things can be ingesting smoke from cigarettes, drugs, alcohol, anything like that can affect the baby, so they're told to avoid. But pollution is never one of these things that they're told that may have an effect on the baby, so to avoid. So the method, we're looking at studies done during pregnancy to see if the pollution has an effect on the developing baby and does cause asthma. So we're looking at the mother's exposure and the exposure to different pollutants and seeing if during different trimesters exposure is worse for the baby. And then we're going to see the different studies follow the kids throughout the first months and years of life to see if they do in fact cause asthma-like symptoms like wheezing, coughing, and those kinds of things. So moving on to my research, the first thing we're looking at is if the different exposure effects on development. So the first 9 months that a fetus spends inside its mother is a critical development period. During this time, mothers are told to avoid different things because this is such a critical development period. So the first study looked at pregnant women who lived in an area where coal is a main source of heating. And in this area, the pH levels were very high. And so the study followed these children who were born in this area, who the mothers were exposed to these high levels throughout the first years of their life, and they found that prenatal exposure to high pH caused decreased lung function. What toxins have the worst effects? So this study examined pregnant women and pollutants they're exposed to, and they followed up with the children during childhood and studied the effects that the pollution had on them. And the study overall found that certain pollutants ingested by mothers had bad effects on children's lungs. And these pollutants that have the worst effects were PM, NO2, and TS. So traffic pollution and prenatal development. This study used odd ratios to determine the effect of traffic-related prenatal exposure on children. And this study found that prenatal exposure to nitrogen dioxide causes increased risk of asthma. And they also found that it was especially during the second trimester. So this nitrogen dioxide basically comes from cars and buses, planes, anything like that. So the levels, anyone who lives in like a high traffic area, like a city, it's going to have worse NO2 levels or nitrogen dioxide levels. Exposure during different trimesters. So a study analyzed daily exposure to pollutants during different trimesters, compared the exposures to the development of asthma in children before the age of 6. This study found that exposure during mid-gestation put child most at risk for asthma. And this study also compares to the last one that we just looked at on traffic, because they found that during mid-gestation was the worst for a mother to be exposed to pollutants and for it to affect the baby. So limiting prenatal exposure. This study examined many studies on prenatal exposure to pollutants and development of asthma in children, and this study found that exposure to fine pollutants put children at risk. Every study suggested that gestation was critical growth period and the fetuses are very sensitive. So any kind of pollutant that the baby is going to be exposed to is going to put them at risk for developing asthma or wheezing or coughing or anything like that. Therefore, mothers should avoid pollutants because they can cause breathing problems in their children. So overall, my research found that prenatal exposure to pollutants can cause asthma in children early in childhood. There are certain toxins that are found in our air that, if exposed, put the child more at risk for asthma development. The toxin that is prenatally exposed put the child at risk for asthma are M, NO2, and TS. Throughout my research, I also observed that the place a woman lives during pregnancy can also put a mother more at risk for encountering the toxin NO2. This toxin is found in areas with high levels of traffic, and as I mentioned above, when a mother inhales this, it puts the fetus most at risk for the development of asthma. Multiple studies I examined also suggested that there are certain phases of gestation that a fetus is most at risk when exposed to pollutants. These studies say that when a fetus is exposed at second stage of gestation or the second trimester, this also puts them at greater risk for development of asthma. Every study I found on the topic of prenatal exposure to pollutants and the development of asthma included one common suggestion to pregnant mothers: that they should limit their exposure to toxic pollutants found in our air. Although these pollutants are many times invisible to our eyes, we inhale them on a daily basis. The more a mother inhales these pollutants, the more they expose their children to the toxic pollutants that affect their lungs. Although my research says that a child is most at risk during the second phase of pregnancy, it's important to limit exposure throughout the pregnancy. Women need to be educated on the dangers of that pollutants have to their fetus before their child is born. If women prevent pollutants while they're pregnant, the exposure to pollutants while they're pregnant, they can help their child avoid being diagnosed with asthma. Many people are unaware of the effects pollution has to the development of children that are still in their mothers, so it's important that we make more people aware of the threats that pollution has to the development of a child's lungs. And then these are my references.